So my dissertation research focuses on the perinatal care experiences of women with physical disabilities, a hard to reach, often isolated, and understudied population, specifically in Canada. All right. Thus far, I have interviewed 9 women with a range of physical or mobility limiting disabilities in the GTA, including women with cerebral palsy and spinal cord injuries. Although American data indicate that women with physical disabilities are giving birth at similar rates to non-disabled women, they continue to encounter barriers to care. Most notably, women with physical disabilities encounter healthcare providers who hold negative attitudes and assumptions about disabled women and their capabilities, including the assumption that women with disabilities are high risk, and they often encounter inaccessible care settings. Many of my study participants reported that their providers lacked information about the interaction of pregnancy and disability, some commenting that they were the first patient with a disability that their provider had seen, and as such, their perinatal care experience was more or less considered an experiment. Many reported having to educate their providers and advocate for particular types of care, including as little intervention as possible. Many participants reported feeling that they faced an extra layer of scrutiny, having to prove themselves as fit mothers. Participants felt as though they were in a catch-22 situation. There were very few resources, but they need to access them, but they were afraid to ask for help or access resources due to the fear of being judged or even losing custody of their children. The thought of losing custody of their children was anxiety-producing, particularly as participants reflected on the recent case of parents in Mississauga, both with cerebral palsy, who almost had their child taken away by CAS. For disabled women, pregnancy is a normal event, and they expect to be given choices, control, and continuity of care within maternity services, and to be treated equitably like their non-disabled peers. More disability-related content is needed in education and training programs, and we need more multidisciplinary care teams rather than siloing perinatal care providers over here and providers who deal with disability issues such as pain management over here. We need to acknowledge that for many disabled women, living with a disability is normal to them, and they should be credited with having knowledge and expertise about their bodies and what type of care they may need. Thank you.